At the beginning of this lecture, we will review about the structure and function of the food digestive system. The medical related to the food digestive system will be discussed. The reading materials and the handout given will be the tool for you to study and hope you pass the quiz at the end of the study. The function of digestive system is to break down the food you eat, release their nutrients, absorb those nutrients into the body through blood and lymphatic system, and finally excretes the waste product out of the body. It is starting from mouth, esophagus or food pipe, stomach, small intestine, the large intestine, through the rectums and anus. These organs work in harmony with many organ systems in the human body. We group these organs to two main categories. The first group is the organ that involve canal, or we call elementary canal because element means to nourish, and accessory digestive organs like liver, gallbladder, and pancreas. Both systems orchestrating the breakdown of food, then taking the nutrient into the body. The digestive system is located in the biggest body cavity called abdominal cavity or peritoneal cavity, usually connect to pelvic cavity. Somehow we call this cavity as the abdominal pelvic cavity. I hope you still remember the other important cavities in the human body from the previous lecture about anatomy, precision, and body cavities. Please also remember what peritoneum, which is the layers of the thick serous membrane that lining inside the peritoneal cavity. You will see what like peritonitis mean the infection or inflammation of peritoneal cavity, and the word peritoneal fluid means the fluid collected inside of this cavity that may needed to be drained out or brought out to be tested by the procedure called abdominal paracentesis. Since the name of the organ is the root element of the medical word, again you may need to memorize these names to construct the medical words. Starting from mouth or oral, salivary gland, esophagus or the food pipe as I have mentioned earlier, stomach, small intestine, which you may need to know the name of each part is duodenum part, the first part of the small intestine after the stomach, then jejunum part and ileum part before changing to be the large intestine. For the large intestine, you have to know the name as the cecum, colon, rectums, and anus. You should be able to identify the appendix in this photo too. The accessory organ like liver, gallbladder, the bile duct, and pancreas are also important for you to remember. The reviewing of anatomy may make you understand more about the organs, function, and anatomy. But most of the English name we call will not be used in the medical word construction. Again, the next level is to remember more about some Latin and Greek related elements. In order to make it easy to you, I have grouped the words as the elementary and accessory system related words. In this slide, start with mouth, which will be or. Or means mouth. Al or al means pertaining. So oral means pertaining to mouth. Oral cavity means the mouth cavity. You may get familiar with word dentist also in this slide. Dent means teeth. Test means specialist. So the dentist is a doctor about teeth. This slide also demonstrates the word elements related to elementary digestive system. Esophagus is the food pipe. Scope means using the instrument to study it. So you can guess what the doctor wants to do with the patient if he wants to perform the esophagoscope. If you remember suffix itis, then put them behind all of these roots. You will get the meaning of these organs with the meaning of inflammation troubles, such as gastritis, mean the inflammation of the stomach, enteritis, duodenitis. This slide shows the example of words related to accessory organs. I let you tell the meaning of hepatitis, pancreatitis, cholecystitis. Please practice by using suffix ectomy with all of these root elements too. Some common used elements in digestive system that you will see so often, like anorexia. Orexia is a suffix means appetite. An means no. So anorexia means the patient has no appetite for eating. The pepsia mean digest, and dis mean malfunction. So the word dyspepsia is the alteration of digestion, with the feeling of the painful on the abdomen. The suffix emesis means vomit. Hyper means a lot. Then, please guess the meaning of hyperemesis. Please review the reading material and complete the quiz at the end of the session. If you have any question or suggestion, please don't hesitate to contact me. Thank you.